Welcome to This Explainer, where we're diving into a medical story that is just, well, it's incredible. It's about technology, a really difficult choice, and one 14-year-old girl whose life was literally on the line. So let's get right into it. Our story doesn't start with some big miracle or major breakthrough. It starts with a small, clear piece of plastic and silicone. To the people who saw it, it wasn't anything fancy. They just called it a device. And this is who it was all for. Meet Anika Rahman. She's just 14 years old, and she's getting a pretty standard treatment for an autoimmune condition. Everything's going by the book. But then, out of nowhere, her own medicine turns on her. It causes this catastrophic, totally unpredictable failure of her lungs. And her doctors? They were completely stumped, baffled. All the standard medical knowledge, everything built on what works for the quote-unquote average patient, it just completely failed her. Anika was an exception, and the system had absolutely no idea what to do. This is where things get really interesting. A biomedical engineer, Dr. Farhan Ali, shows up with a pretty radical solution. It's called organ-on-a-chip technology. So just picture this, a tiny, living model of a human organ, small enough to fit in your hand, that actually functions just like the real thing. And these chips are amazing. I mean, this isn't just a bunch of cells sitting in a petri dish, no way. They create this whole dynamic little world. You've got these microscopic channels with fluid pulsing through them, just like blood. And you've got a central membrane that actually stretches and relaxes, mimicking the mechanics of breathing. It's like a perfect little mirror of what's going on inside your body. And this was Dr. Farhan's game-changing question. Instead of just guessing which drug to try next on Anika herself, a huge risk, he said, what if we build a personalized model, a copy of her lung, using her own cells, so we can safely test these drugs outside of her body? It was a pretty wild idea. So how'd they actually do it? Well, they carefully took some of Anika's lung and blood cells and placed them onto the chip. And here's the cool part. The cells just knew what to do. They started organizing themselves, forming the complex tissue of a real lung. Then they hooked up tiny pumps to make it breathe and to circulate fluid. They had literally created a living, breathing avatar of Anika's organ. Okay, so Anika on Glass is up and running. It's go time. The team introduced the 3 potential drugs one by one into the chip, and then they just watched. They watched in real time to see exactly how this tiny version of her lung would react. And the results were just stunning. Drug A? It caused massive inflammation. The tissue started leaking. It was a disaster on the chip, just like it was in Anika. Drug B, though, left the tissue stable, healthy. It looked good. But here's the real kicker. Drug C. At first, it seemed okay, but the chip showed that after 48 hours, it became toxic. A delayed reaction they never would have seen coming. A ticking time bomb. Now, you'd think with data that clear, it's a no-brainer, right? Well, not so fast. The clinical team was really skeptical. I mean, you can kind of see their point. It was this classic showdown. Brand new, objective data from a little device versus decades of hard-won, gut-level experience from treating patients. But Dr. Farhan's response to that was simple, and it was powerful. He asked them, okay, with all that experience, how many times have you ever seen a patient react exactly like Anika? And you know what the answer was? 0. Not one. Their experience was built on averages. Anika wasn't an average. She was a complete outlier. You know, the moment that changed everything didn't come from a scientist or a chart. It came from Anika's mother. Her plea just cut through all the debate. She said, if this chip can suffer, so my daughter doesn't, then listen to it. I mean, wow. Let the technology take the risk so her child wouldn't have to. And that was it. That was the turning point. The doctors made a choice. They put their trust in the logic and the hope that this little device represented. They decided to give Anika drug B. And the results? They were immediate and undeniable. Within just a few hours, her condition stopped getting worse, which was already a huge win. A few days later, her oxygen levels stabilized. And in just a few weeks, Anika Rahman walked out of that hospital. The chip had been right. Anika's story is so much bigger than just one amazing success. It's a powerful glimpse into a possible future for all of us. A future where treatments are tested on a you-on-a-chip first, where we can predict these rare, dangerous reactions before they ever happen. It's about medicine becoming truly personal again. Years later, Dr. Farhan put it all into perspective with this really profound thought.
He said the chip, the technology, it carries information, it gives you the data, but it can't bear the weight of the choice. Technology carries information, but humans, the doctors, the family, they're the ones who have to carry the consequences.
And that leaves us with this final question to think about. As our technology gets so powerful that it can practically predict the future, it really forces us to ask, where's the line between the data that guides us and the human courage it takes to act? What are the choices that should always, always remain in our hands?